Okay, mama, so you've done some self-reflection and you have identified some topics that are important to you, some services that are important to you to receive during your care with this practice, right? So you've done that, and now we've taken that list and we are moving on to interviewing our providers, okay? You want to interview your providers sooner than later. And I'll talk about that at the closing of this video because it's very important that you do that, because it's going to save you some headache later in the event you become unhappy with the practice that you're with. So due diligence. We're researching and we're being selective about who we're partnering with to be an active participant in our own care, okay? One thing we do want to note is that not every woman wants the same thing. What's important to me may not be important to another woman. I might want a midwife, another woman may want a doctor. I might want a natural birth, another woman may want an epidural. So that's why the self-reflection is very important, because you get to identify what's important to you as far as the services you'll be receiving prenatally. Okay, so let's use the example of a mom who desires a natural labor experience in a hospital setting. There are a lot of things that happen in a hospital setting that you do not have to deal with in the home setting. So let's just use this as an example. A mom who desires a natural birth in the hospital setting. The first question she's going to ask is, does this practice support mothers who desire to birth naturally? You need to ask that right up top, because you'll know your answer. And if the answer is no, you can get your purse and walk right on out the door, right? You can get your purse and walk out the door, because that would be the end of the conversation, right? Respectfully thank them and go on about your way. If it is a place that offers natural birthing options to women, you want to delve deeper into that. You know, what other birth options do they offer? Do they offer water birth, which is actually giving birth in the pool? Or do they offer hydrotherapy? Is hydrotherapy an option at the facility you'll be birthing at? And hydrotherapy is basically the use of water during your labor as a tool for labor, as a coping mechanism, and as a comfort measure during labor. And it's great. It's very beneficial. So you want to ask, are any of those your options with this practice and at the facility you'll be birthing at? Want to ask, which facility will I be birthing at? Because you also want to go into researching that facility, their cesarean rates, their induction rates, their policies. Do they have policies that are friendly to low risk patients? So that is something that you will also have to look into as well. So those are really good questions to ask up front, okay? The next very important question to ask would be midwifery care. Does this practice have midwives? If you do, can I see them exclusively so that I can have my natural, the natural approach to my care? Especially if there's no complications going on in my pregnancy, can I see my midwives exclusively, and will they attend my birth? Another great question to ask are, what are your alternative options during your prenatal care? For instance, a lot of moms don't want to drink the glucose solution when they're testing for gestational diabetes, because it's, some of them have other chemicals in it that might be harmful and they don't want to ingest it. So the question would be, is there any other alternative option to the gestational diabetes test? Because I heard that there are some chemicals in there that may not be healthy for my body. Okay, so every question that you ask is going to be backed up with some data, okay? How many moms are being induced and why, okay? Induction means using medication to bring about labor in the hospital. So you want to ask, what is the induction rate and how many women are being induced and for what reasons, okay? Because I read, this is what you're gonna say, I read that induction of labor actually increases my chances for cesarean, and I wanna avoid that at all costs. Like, I don't want a cesarean, so I don't really wanna be induced. So what is the policy behind induction? What is your policy when moms go past their due date? Would I be allowed to go past 41 weeks just to see if my body will kick in labor? Or will I be pressured to be induced at some point? And what point would that be? As you really want to ask that question, because a lot of practices are in the habit of inducing moms because they've reached their due date, or because they're one day over their due date, or just because. Okay, and that is not a reason to be induced. If there's no medical rationale behind induction, we should not be agreeing to being induced, okay? You also want to ask, what are the policies for low-risk mothers when laboring on the unit? Are low-risk mothers allowed to move around and walk around the unit or around the room or bounce on the birth ball? And then back it up with, I know that labor can progress naturally if a mom is up and walking and moving around. Mobility and activity helps labor to progress naturally. Is that something that I would be able to do in the hospital? Would I be forced to be on the monitor, the fetal heart monitor, throughout the entire labor course? Or would I be able to be off of the monitor for periods of time and them check the baby intermittently? Because I read that continuous fetal monitoring does not improve birth outcomes. So I would really not like to be on the monitor if at all possible, especially if my labor and my pregnancy have been without problems. So that's a good question to ask, and they'll be real surprised at that. But they'll either say yes or no, and you write the answer down. If you're laying in bed the entire time, that's going to increase your risk for getting an epidural, and also increase your risk for being induced or augmented with a medication to bring about stronger contractions. So we want to make sure that that's not something that we have to do if at all possible. So mothers who have already decided that they want a natural birth experience in the hospital setting have probably already hired a doula to be a part of their birth team. So you want to make sure the practice that you're interviewing is doula friendly, right? You want to make sure that you can have your doula in the room supporting you through your labor, and that there won't be any sort of hostile energy in the room because you have a doula who's being an advocate for you and who is helping you cope through your labor. So you really want to make sure that that is not problematic for the practice. There are practices that do not allow doulas to be present. For whatever reason, some practices don't allow it. So you want to make sure you're not with a practice that does not allow or that restricts a member of your birth team to be present to help and support you. Can I eat and drink during my labor? Research shows that eating and drinking during labor does not increase the risk for complications. Can I do that? Labor takes a lot of energy and it takes a lot of calories, and I'm burning a lot of energy to, birth a baby. Would I be able to snack during my labor? Would I be able to drink and eat orally during my labor instead of being pumped with IV fluids through the entire time? The cesarean rate. How many moms are sectioned and why? Okay. There are many frivolous reasons why people are being sectioned. And there are many medical reasons why women are being sectioned. But you want to make sure you're not falling into the category of women being sectioned due to a failed induction for no medical reason. And in Georgia alone, the cesarean rate is 33%. Okay. The World Health Organization set a goal of less than 20, and we're in Georgia at 33%. Another question that's really important is to inquire about if the facility that you'll be birthing at is a teaching facility. Teaching facilities have many residents who just kind of pop in and pop out of the room. And if you're wanting a more private experience, you have the right to decline resident care, okay? So you want to really make sure, is the facility that you're birthing at, do they have many residents that are part of the care and will be just popping in for the birth to catch the baby? If so, you can make it known up front that that's not really what I'm looking for, and that's not what I desire. I don't want to have lots of residents in the room when I'm giving birth. Do you practice giving mothers their babies to initiate the golden hour? As you can say, I've read that skin to skin will keep my baby warm, will help regulate my baby's breathing during transition. Skin to skin will help stabilize the blood sugars of my baby. Skin to skin also decreases the stress hormones in me and my baby. Skin to skin also will help my bleeding to be minimal during my postpartum care. And it also initiates early breastfeeding. So is this something that your practice and your providers in this practice honor? Is that something that I can look forward to after birth? Delayed cord clamping. That's another procedure that's been proven to be beneficial to your baby. You want to ask, do you cut the cord right away, or can you wait at least 90 seconds for my baby to get the 30% of the fetal blood that's housed in the placenta to be given back to the baby? Is that something that you all do or offer if moms desire or request that? Is that okay? As far as the practice, if it's a group, you want to ask, how many doctors are in this group? How many providers should I expect to meet during my care? I'd like to know everyone who might attend my birth. So will I have an opportunity to meet everyone? If I like one doctor, would I be able to stay with that doctor or midwife? What are my options as far as choosing who I'll see most of the time during my pregnancy? Is that even set up that way for patients to request or not? Because a lot of moms don't like that. They don't like seeing multiple people because there's no form or sense of intimacy, and it's hard to build a relationship when you have a large group of physicians or midwives that you really don't know too well, okay? So that's something that you can also inquire about. You may need to look for a smaller group of practitioners for your experience, because you might be looking for that. Lastly, I want to really encourage mommies to this research, because it's very difficult to switch to a new provider later in your care. Providers and practices have policies in place that restrict moms from coming as new patients if they're later in their pregnancy. You can't just show up anywhere at 33 weeks and say, I didn't like my provider, I'm here, because I want a new provider. It can be a very complicated situation, a complicated position to be in, and that's something you don't want to do. Trust. Hey boss mamas, thank you for watching my video. There are so many more on the way, so make sure you press the subscribe button, share with your girlfriends, and let's start getting informed. Welcome to the Boss Mamas Birth Movement.